Hi, my name is Mason Peterson, and this is our project on combined correlational network for identifying behavioral health cases from first responder reports. So, first, some background. More than 60 million adults in the US have some kind of mental health issue. Around 46 million Americans 12 or older suffer from substance abuse disorders, and 911 is often the first place contacted for these individuals. The reports made when these calls are followed up on are annotated at the end of the month to recommend afflicted persons to appropriate facilities. However, first responder services are typically understaffed and often annotation is tedious and error prone. So, you can see how a system stretched thin is only stretched thinner. Finding a way to improve the annotation process would help not just the people with behavioral health issues, but would also help first responder services. So, what is our project? Our project is a multi-class classifier that sorts police reports into one or more behavioral health classes. We use a dataset of around 1,050 annotated police reports. We also use a list of behavioral health professional curated keywords. Previous works did not use multi-class classification, they only did binary, and this is not representative of what you would actually see. So I'm going to go over the behavioral health classes, just their descriptions and also the distribution. So looking at the bottom left, we have mental health. This is involving people who have mental health disorders like schizophrenia, suicidal ideation. Then we have mental health crisis and substance abuse. This is things where people have mental health disorders and substance abuse disorders. Domestic social, this is involving in a home setting individuals like mom, son, father, daughter, things of that nature. Non-domestic social, this involves multiple individuals not in a home setting, so this is like committing crimes on those not related to the perpetrator. Substance abuse, this involves individuals with persistent drug/alcohol abuse problems. And if we look on the bottom right, we have a distribution of all of these different behavioral health classes. So we have for domestic social, 715 examples, substance abuse, 349 examples, mental health, we have 302 examples of those, non-domestic social, 151, and mental health crisis and substance abuse, we have 104 examples of that. I thought I'd also go over the evidence types. So if you look on the table at the right, we have all of the evidence types, them listed with their descriptions. So going from top to bottom, we have situation. This is terms that describe situation of the incident, especially with aggressive inclinations. So uncooperative, suspicious, surveil. Situational mental health is basically that, but related to mental health. So acting strange, anxiety, bipolar. Child is just things that are associated with juvenile involvement. So infant, youth, teen. Crime is related to crime conduct. So assault, homicide, battery. Disposition is terms that describe what happened to an individual after or during the incident. So refused, released, denied medical. Disposition, mental health, basically the same thing, but related to mental health cases, and you have the same keywords listed. Drugs is terms related to illegal drug involvement, so alcohol, cocaine, heroin. Medication, this is just related to prescription medication, so enoxaparin, Clozaril, Lovix. And then medication mental health is medication for mental health issues, so antidepressants, Lexapro, and anti-anxiety. So these are the feature sets. We're training our network on these co-occurrences between these different feature sets. So looking on the table at the bottom, just walk through this. So the example report I made up was suspect was in possession of crack, marijuana, and Risperdal. He seemed erratic. So if we go from this to top to bottom, first we have classes given types. And so you can see drug, situational mental health, and medical for the substance abuse behavioral health class. And then we have keywords given class, and then it's crack, marijuana, erratic, Risperdal for substance abuse again. If these were classified under multiple classes, which reality they are, then they would also be filed under that as well. So it'd be like domestic dispute, and then drug, situational mental health, and medical. And then if we look on the bottom one, we have keywords given types, and then these are specific to the evidence type. So crack and marijuana for drugs. So how does the classifier work? First, we take the data, then we pre-process, and then we embed. And then from there, we train feed-forward networks on co-occurrences between different statistics found in the police reports. And these are evidence types given a behavioral health class, keywords given a behavioral health class, and keywords given an evidence type. A feed-forward network is then trained on sentences containing keywords, and then all of those embeddings are concatenated along with label embeddings, and then a feed-forward network is trained on those concatenated embeddings. and that's how we get our results. So how did we do? I think we did pretty well. We got an accuracy rate of 72% compared to Roberta's 61%, Bert's 58%, and BioSTM's 38%. You can see on the right the different performances based on the class types, and this is mainly due to scarcity of some of these classes within the dataset. So I thought I'd also include an example of correct and incorrect classification. So if you look at the top right, we have on date 1 at time 1, I was dispatched to Cardinal 1, Facility 1, GPE 1, GPE 2 at the Facility 2 apartment complex in reference to a domestic dispute. Upon my arrival, I met with Person 1 and her sister Person 2. Person 3 advised her boyfriend Person 4 was intoxicated. So this is domestic social, and it predicted it as domestic social. Now we have the incorrect classification of on date 1 at time 1, I arrived at location 1 in reference to the residents inside smoking marijuana. I walked up to the door through Cardinal 1, different vehicles in the driveway, and immediately could smell the odor of marijuana. So marijuana is mentioned here twice. Pretty obviously it should be substance abuse. However, it categorized it as domestic, social, and mental health. So further research. Obviously, the framework can be further refined. We can look at the parameters being used. We can adjust those, things like co-occurrence ceilings. And then that brings us into the next thing, which is understanding the contributions of co-occurrences between feature sets. Right now, we don't have a very clear idea of how much each of these feature sets contributes to the overall model. And then we also think that incorporating human feedback or having human involvement in some kind of way within this categorization process would improve the process a lot. So our conclusions. Obviously, the model did pretty well, and we believe that this research can be utilized and adapted by first responders or in similar multi-class classification problems, and it can just be used as a general framework. We also believe that if implemented, it would help first responders facilitate fast and efficient intervention for individuals with behavioral health related problems in getting them the help they need, and it would also help alleviate the system. So, acknowledgements. I'd like to thank Department of Computer Science, Kennesaw State University. I would also like to thank Department of Information Systems and Services of Kennesaw State University. And I would also like to thank the Department of Social Work and Human Services from Kennesaw State University. And these are the citations, and some of these were used within the slides.